Hey everyone, and welcome back. This is one of a series of videos covering topics in American politics. In this video, we're going to explore the public policy process. But let's start by coming to terms with what we mean by public policy. In the simplest terms, public policy can be defined as the course of action or decisions made by a government or an organization concerning a particular issue or set of issues. It is a deliberate plan of action designed to address specific societal problems, needs, or goals, and can take the form of laws, regulations, programs, and initiatives, often reflecting the government's values, priorities, and objectives. The public policy process is usually divided into 5 distinct steps or stages, though in reality the various stages often overlap or movement between them can be uneven. The process begins with the agenda-setting stage, where issues or problems are identified, brought to the attention of policymakers, and placed on the political agenda for consideration. Once the issue has garnered sufficient attention, the debate over policy formulation begins. Here's where policymakers, whether they are elected representatives or members of the government bureaucracy, develop potential solutions to the problem identified during the agenda-setting stage. At some point, a specific policy is adopted, for example by passing legislation or implementing regulations within the bureaucracy. Once a policy is adopted, it's put into action in a stage referred to as policy implementation. And finally, policymakers and stakeholders may assess the effectiveness, efficiency, and impact of the policy in a stage referred to as policy evaluation. Sometimes this can even result in the identification of new problems and issues, restarting the entire process. But let's consider each stage in a bit more detail. The agenda-setting stage is the first stage in the public policy process, and it's where issues or problems are identified, brought to the attention of policymakers, and placed on the political agenda for consideration. Key activities during this stage include the identification of problems, framing of issues, and the mobilization of public opinion and interest groups to draw attention to specific concerns. The key actors at this stage include government officials, interest groups, the media, and the public. Policy formulation is where policymakers identify and develop potential solutions to the problem identified in the agenda-setting stage. In this stage of the policy process, policy objectives are outlined, various policy options are identified, and research and analysis is conducted in order to evaluate the potential impacts of each option. Key actors at this stage can include issue experts, think tanks, government agencies, and legislative committees, all of which are influential in articulating and evaluating competing policy options. In the third step, policy adoption, decision makers select specific policy options, usually from the list of options identified in the previous stage, and formally approve or adopt one or more into law or governmental action. This stage can involve legislative debates, committee hearings, presidential or executive orders, and other executive branch involvement. Ultimately, a decision by the legislature or some executive authority results in the adoption of a specific policy. Elected officials, including legislatures, the president in the case of federal policy, and interest groups all have significant influence in policy adoption. Regulatory decision makers can also be involved in policy adoption, particularly when authority is delegated to them by the legislature. During the policy implementation phase, the adopted policy is put into practice, and policy goals are translated into concrete action and regulation. Implementation can involve the development of administrative rules and procedures, resource allocation, hiring of personnel, and carrying out the activities necessary to achieve the policy's goals. Governmental agencies, bureaucrats, frontline workers, and the private sector can all play a role in policy implementation. And finally, the policy evaluation stage is where policymakers and stakeholders assess the effectiveness, efficiency, and impact of the policy. Such evaluation can include data collection and analysis of outcomes, and the consideration of whether the policy has achieved its intended objectives. This may even lead to adjustments or revisions in the policy or the termination of the policy itself. Influential actors in this stage can include researchers, evaluators, government agencies, and advocacy groups, as well as the general public. Let's look at this abstract model using a couple of real-world examples. Let's consider the Affordable Care Act, also known as Obamacare, and the 2012 decision by the state of Colorado to legalize the recreational use of marijuana. In the early 2000s, the rising cost of healthcare and the growing number of uninsured Americans became pressing issues in the United States. Various stakeholders, including advocacy groups, healthcare providers, and policymakers, highlighted the problems of high healthcare costs and limited access to insurance. The issue gained significant attention during the 2008 presidential campaign, with candidates proposing healthcare reform as a top priority. The agenda-setting stage for the legalization of marijuana in Colorado looks slightly different. In that case, the debate over the legalization of recreational marijuana gained momentum in the early 2010s as advocacy groups like the Campaign to Regulate Marijuana Like Alcohol collected signatures to put the issue on the ballot. Public opinion polls and concerns about the costs of marijuana prohibition contributed to the agenda-setting process. Policy formation in the case of the Affordable Care Act was framed by a desire to address the high healthcare costs, lack of insurance coverage for millions of Americans, and gaps in healthcare quality and accessibility. So the Obama administration, with input from Congress, developed a comprehensive healthcare reform plan. Extensive research, public hearings, and consultations with experts and interest groups occurred, and multiple policy options were considered, ranging from a single-payer government-based system to expanding access to Medicare and Medicaid to expanding access to private health insurance and others. In the case of Colorado, the policy problem was framed in terms of the rise of an informal drug market, which strained law enforcement resources, led to health and safety risks, and reduced government tax revenue. To address the problem, the Colorado state government, along with stakeholders from law enforcement, public health, and the marijuana industry, developed Amendment 64, a draft initiative measure to amend the state constitution to legalize the recreational use of marijuana for adults and to establish a regulated market. Ultimately, the Affordable Care Act was adopted through the legislative process, passing the Senate in December 2009 and the House in March of 2010, before being signed into law by President Obama later that month. The legalization of marijuana in Colorado, by contrast, was proposed as a ballot initiative approved by the state's voters in November 2012. After the ballot initiative passed, the Colorado legislature passed additional enabling legislation to regulate and tax the marijuana industry. After the respective policies were adopted, the process of policy implementation began. In the case of the Affordable Care Act, extensive rulemaking by various federal agencies was required, specifying how precisely the law would be implemented. Resources were allocated to establish the necessary healthcare exchanges, subsidies to fund Medicaid expansion, and to finance other components of the ACA. Agencies and healthcare providers had to hire staff and provide training to carry out the law's provisions. In the Colorado case, similar implementation had to take place with state agencies, including the Colorado Department of Revenue, creating regulations for licensing marijuana businesses, testing, labeling, and taxation. Funds generated from marijuana sales taxes were allocated to various state programs, including education and public health, and state agencies hired staff to oversee and regulate the new industry. Finally, both policies entered the policy evaluation stage. In the case of the Affordable Care Act, researchers and government agencies have continuously evaluated the ACA's impact on healthcare coverage, cost, and quality. This has involved analyzing data on the number of uninsured individuals, changes in healthcare costs, and the effectiveness of preventative care measures over time. At the same time, the ACA has been subject to amendments and adjustments, such as the elimination of the individual mandate penalty in 2017. And while in terms of the items being evaluated differed, the process of evaluating the policy impact and effectiveness of Colorado's marijuana laws involved similar steps. Researchers and state agencies continue to evaluate the impact of marijuana legalization on public health, safety, revenue generation, and the criminal justice system, and based on ongoing evaluations, the state has made adjustments to regulations, including addressing issues related to impaired driving and underage access to marijuana. But that's it for now. Please leave any questions you have in the comments section below, and thanks for watching. Bye.